going to review the administration of epinephrine in situations of anaphylaxis. Anaphylaxis, a severe allergic reaction. We're not talking about someone with a few hives. We're talking about someone who has true compromise to their airway, to their breathing, or circulatory compromise. So when we're looking at that, symptoms you might see facial swelling. The patient might be unable to swallow. There might be sounds. You might hear stridor. You might hear wheezes. When you check peripheral pulses, you may have difficulty identifying them. They may be very, very fast. They may be faint. They may have a low blood pressure. Any one of those things compromised to airway, breathing, or circulation indicates that you may consider the administration of epinephrine in an allergic reaction. So when we're going to administer epi, we have two doses. We have an adult dose of 0.3 milligrams, and we have a pediatric dose of 0.15 milligrams. So I'm going to show you how to draw them up. You're going to have a 1 milliliter syringe. You're going to have a 21 gauge needle. It's 1 inch long. A vial of epinephrine. It's marked adrenaline. There's 1 milligram in 1 milliliter. And you'll have a chlorhexidine wipe. So I'm going to look at my epi, I'm going to look at the back of it, and I'm going to see the expiration date. I'm going to flip the top off. If I think I've contaminated it, I can clean it with my chlorhexidine prep. This may say adrenaline, or it may say epinephrine. I'm going to clean the top of the vial. I'm going to take the epinephrine, I'm going to take the syringe, put it through the little rubber stopper, invert the vial, and this is where you have to make sure the tip of your needle is actually in the medication. And what we're going to do is we're going to administer 0.15 milliliters, 0.15 milligrams. So we're going to pull down to approximately 0.2, just a little bit extra. We'll take this off, clear any bubbles, and then we will go up to the 0.15. So now I have 0.15 milliliters of epinephrine. The site for administration is lateral mid-thigh, so the middle of the leg on the outside. Identify our site. We're going to quickly clean it, circular motion, inside out. We're going to take our epinephrine. We're going to go in at a 90-degree angle to the skin. We're going to pull back slightly on the plunger. You're doing that to make sure you're not in a small blood vessel. If you are, you would just readjust the position a little. And then you're going to push it rapidly. Remove the needle. You do not want to give epinephrine if the patient has no compromise of airway, breathing, or circulation. If they've just got some hives, do not administer epinephrine.